The following is a paid program. The advice and opinions expressed during the program are that of Informed Choice, not necessarily WBEV or Good Karma Brands. Welcome into Taking Care of Business with Informed Choice, here with Troy VandenHeuvel.
Yep.
Yes, I knew I'd get it this time. And we're welcoming you in, as we do on a regular basis now, to talk with you about some heavy but important topics. Maybe topics people don't want to talk about or forget to talk about.
Yes.
Before we dive into those, though, I do want to remind people of how they can find you. And I have notes. I keep notes here for this. We've got offices in Horicon, Madison,
Yep.
Green Bay,
Yep.
Fort Myers, Florida.
Correct.
And that's all of them, right?
That
the
is.
four? Okay,
Yep.
perfect. 877-4INFORM. That's the number 4, INFORM, is the phone number. And informedchoice.com is the website. Let's introduce everybody to who you are again.
Sure. Troy VandenHeuvel. I'm the sales manager for our Horicon office as well as our Madison office. Been with the company a little over 4 years, I believe 4 going on 5. Been doing this for approximately now 12 years in total.
So it's not new for you.
No.
But we know that these things aren't stuff that just stays stagnant.
Correct.
Things change all the time.
Correct. Absolutely correct. So with this year, in my opinion, there's going to be some of the biggest changes that are coming to Medicare that are going to take place over the past 10 to 11 years. Most specifically, I'm talking about changes into prescription drug coverage. Okay.
Now, is this something we knew was coming? Like we saw this coming?
We absolutely did.
Okay.
We absolutely. This was passed through Congress a couple of years ago, I believe, and now they're just trying to roll it out and implement it into the 2025 fiscal year.
And that's always messy.
Generally.
Generally.
Yes, absolutely. So for anybody that's currently out there that's listening, that's on Medicare, you may be familiar with what's called the donut hole or the coverage gap, right? And for those of you who may not be on Medicare and they're listening, they're like, donut hole coverage gap, right? What is that? So how that's set up this year is you will, let's just say you're taking Xarelto, or you were taking Jardiance, or you were taking a named brand prescription medication. You would first have to satisfy a deductible,
Right.
Okay? Assuming if there is one, and a lot of you who may be listening are used to deductibles with employer plans. But first, you would have to satisfy your deductible. After that, your copays would set in, okay? You would continue paying those copays until the retail cost of the medications, not your small copay when you go to pick it up, whether it was a $5, $10, $47 copay. That's not what the insurance companies will take a look at. Okay, they will take a look at what is the retail cost of the medication. So for brand name drugs, especially, let's just say you have a $40 copay, hypothetically, right? But that drug, the retail cost of it could be anywhere from $800 to $2,000. That's what the insurance companies and the federal government keep tabs of. Okay.
Right.
So if that threshold exceeds a certain limit, you would then enter the donut hole or the coverage gap. At which time, let's just say you were used to paying said $40 copay for Ozempic, right? Because Ozempic is a really
one.
popular prescription medication right now. So you were going along throughout the course of the year. Let's just say you started off with this plan January, met the deductible. January, February, March, April, you had that small copay, but then you would go to pick up the medication in May, and next thing you know, the cost of your medication was just through the roof.
If you're expecting 40, it's definitely not 40.
Correct.
Or whatever it may be.
Right. It could be $250. It could be a $300 copay. And that's typically when we would get the calls. Hey, what is going on with my insurance right now? And we would sit them down, take a look at it, and chances are those individuals would enter the donut hole or what's known as the coverage gap. Okay. Good news. So moving forward for next year, because I know we're throwing out numbers here and it's tough for people out there listening probably to try to follow along. Good news. Next year, there is no donut hole. There is no coverage gap. Okay.
Okay.
Now, how it's going to work is if your true out-of-pocket cost just on the prescription drug portion of it, if that exceeds $2,000, you're done paying for the entire year. Okay? No matter what prescription medications that you're on, assuming they're covered underneath the policy.
Right.
Okay? So once your once your true out-of-pocket costs exceed $2,000, you're done paying. Okay? So that's good news for a lot of people.
Right.
All right? So what the federal government is doing is they took a look basically at 10 of the most expensive medications that were costing them a lot of money. And what they're doing is they're going to be transitioning those costs back onto the insurance carrier. Okay.
Now, when we hear that, that's usually a scary thought, because doesn't that mean the insurance carrier is going to find a way to transition that cost
Yeah, ding,
somewhere
ding,
else?
ding,
Okay.
right? So, a couple of things here. The new policy information for 2025, and you're absolutely correct, right? Historically and typically, what the insurance companies will do is they will pass those expenses along to the client or the customer, okay? New plan information for 2025 does not get released to us until, October 1st. We cannot start to disclose that information to you and what the plans are going to look like until then. However, anybody that's currently on a standalone Medicare prescription drug plan, or if they're on what's known as a Medicare Advantage plan, I would highly, 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 highly encourage you, anything that you're going to be getting from your current insurance carrier, whether it's a Humana, United Healthcare, Network Health, anything that you're going to be getting in the mail starting now, typically to the early part of September, it's going to be called an ANOC. What is that? Annual Notice of Change. You get it every single year. However, I cannot stress to you how many clients of ours will state, never got it, right? Never received it. They have to send it out. By law, they have to send it out.
Okay.
What is that Annual Notice of Change? It's going to highlight your current policy information, plan year 2024, and it's going to show what's changing to 2025. Okay, very easy to read along, and again, it's just going to highlight this is what the policy information looked like this year. This is what's changing. It's not like an explanation of benefits where you get 25 pages. You can't make heads or tails out of it. It's very, very easy to follow along with. Now, once you get those letters, and if you, let's just say, you do not like the changes that are coming, and I can't say one way or the other, are the changes going to be negative? Are they going to be a positive? We have no idea.
Right.
Okay. The actual customer is going to be the first person that's going to be privy to that information. Once you do get that information, you can either call us at Informed Choice and just say, hey, look, I'm really not a big fan of what the changes that they're doing to this plan for next year. Can we schedule an appointment, and can we take a look at other options for either your standalone prescription drug plan or even a Medicare Advantage plan? Because every year it's definitely a good year to do that, especially this year because there's major changes coming to the prescription drug portion of it.
I mean, the thought that that kind of change is going to go, we know it's going to trickle down somewhere. It's got to. Could this also lead to changes of what's covered? Like they might decide not to cover certain medications because of?
Correct. Well, that's a very good question, right? And that's why every single year we really encourage people to schedule a plan review, or you can submit a list of your current prescription medications, and we can find out if your plan is going to cover all of the medications you're currently taking. Formulary, what is that? That means that's the prescription drug component of the policy that will cover all your prescription medications. Formularies, they can change every single year, okay? So just because, let's just say, Jardiance, because that's such a hot topic prescription. Let's just say that was covered underneath your policy for this year. You can't automatically assume that that's going to be covered under the same policy for the following year. Why? Because formularies change every single year. Now, is it very common that they do? Yes and no. But again, that's why we encourage people. It doesn't cost you anything to give us a call, or even with your current agency that you're working with. It doesn't cost you anything to say, hey, look, these are a list of my prescription medications I'm currently taking. These are even the doctors that I currently see. Because like prescription medications, just because the doctor that you were going to see for the year 2024 doesn't automatically mean that they're going to be in that same policy for the year 2025. So it's a very obnoxious time of the year that's coming up, right? Because the annual election period for an individual that's on Medicare to make their change is October 15th through December 7th. We can start to disclose with you policy information October 1st. Why is it an obnoxious time of the year? Because that's when you start to see all the TV commercials, radio, print, media. You cannot get away from it. And unfortunately, what's going to be going on during that time of the year again? the election.
Yeah.
Right?
Yeah. What a year to have all this go right.
Yes,
Oh,
and every
boy.
4 years it happens, and it's not a fun time. But at the same token, that's the time period when you schedule an appointment with your agent, your agency, to just do a policy review.
How often do you see people fall into the pitfall of they go, oh, well, my health hasn't changed, so I don't need to worry about looking into my doctor still being covered. I don't need to look into my medications because if I haven't changed, why would it change?
Correct. More so than not, right? The good thing with that is a lot of our clients, they're relatively healthy, right? So they're not utilizing the plans that often. I'm not saying all of our clients. I'm just saying the percentage of the clients that might see a doctor 1, 2, 3 times a year, and they're like, I was good this year. I don't need to check. Well, let's just say that is the case, and you weren't even taking prescription medications, and your doctor was going to be in the network for the following year with the policy that you had in 2024, and you decide to do nothing, right? You decide not to call the agency you're working with. How do you know that there's not a more well-suited policy for you that could offer you more in terms of additional benefits, right? Or a Part B reimbursement. That's why it's always a good time to at least have a quick conversation with your agent or your agency, whether that's by phone, whether that's by email, text. I mean, there's plenty of ways to communicate with your agency that is not time-consuming.
I've heard it said before, and this applies, I think, for all insurances across the board. Insurance, like your car insurance, is not for when your car's, when you're not in an accident. It's for when there is something that happens.
Correct.
Health insurance, prescription insurance, stuff like that, that coverage. It's not for when you're perfectly healthy and don't take anything.
Yeah.
It's for when you do need it.
Correct.
Because that, it does add up, right? It's expensive out there.
Absolutely.
And we were talking a little bit before the show started about, all the crazy things going on in the world. I mentioned, having a kid who's learning about pricing and, generic versus name brand or whatever. And you mentioned that this affects name brand drugs. Does this affect generics as well?
Well, I mean, so we do not know yet.
Okay.
Right? But I can only assume at this time. That's why it's going to be, especially for this year. Okay. We don't know if they're going to spread those costs out over 2025, or are they going to make minimal changes for the plan year 2025, but then they're going to implement the majority of these changes in 2026. We really have no idea.
Right.
The changes, though, I can assure you, they are coming. Okay, so whether the majority of the costs get pushed on to the consumer or the customer in 2025 or 2026, that is yet to be determined. But again, going back to that annual notice of change, every Medicare recipient out there, you're privy to that information before we are. And again, typically it comes middle part of August to the first part of September is when those annual notice of change notifications go out.
And so, like you said, once you see those coming in, that's a good time to reach out to you guys.
Correct.
Not only does it give you guys a little bit of a heads up as to maybe what's coming.
Correct.
Maybe you can, glean some information from it, but it's before everybody sets into the panic of now I'm in that change window.
Mm-hmm. Correct. Or you just put it on a pile of information and you don't open it up until November, and then you try to get into the agency who you're currently working with. Yeah, we're sorry, we're booked up until December 7th. Now you have to do some of the legwork. It's just a real easy habit to get into during this time of the year. Take a look at it. If you're comfortable and you're content with the policy changes, again, it's very easy to follow along. 2024, this is what's changing in 2025. It's not like you were splitting atoms. It's really easy to read. But then when you have questions, when you take the time to open that up and look, that's when you reach out to us. It's always a good time, too. If you're not happy with your agent or your agency, you haven't heard from them for a while, it's been a couple of years, 3 years, 4 years, and you're just maybe taking the opportunity to maybe shop around, right? Just like car insurance. How many people shop around for car insurance?
Yeah, almost never.
Well,
until they need it.
Yeah, until it renews.
Right.
And then the premium goes up. Then they're like, maybe it's a good time that I should start taking a look possibly at other policies, agencies. Ways of coverage. And
generally, I don't think I've had ever the car insurance companies send me something telling me where it's going to change from the year to year.
Yeah.
They just tell me, oh, this is your new premium.
Correct.
I'm paying that now.
Yeah.
All right.
Yeah.
So at least it's good that they're comparing it for you apples to apples.
Yeah.
So we know that big change is coming up, and we know change is inevitable. But there is one thing that you guys do, and I know I'm pivoting here quite a bit, but there's an event that you guys hold that I really like that isn't changing. in the sense of it's still a good thing that you guys do. And it's a nice little give. Trying to think the right way. It's a good supportive thing you guys do.
Correct.
For our vets.
Yeah.
You've done so much for us. Talk about the haircuts for vets.
So last year was the first year that Informed Choice actually started doing this, and we just created what's called haircuts for vets, right? We thought it would be a good way to give back to the community. It was our first year. We weren't working with you guys. However, we came over here. You guys were able to do a nice little plug for us, and that was the first introduction that we've ever had working with you guys. But lo and behold, fast forward a year later, now we're doing monthly radio shows and advertising. So with that being said, August 20th, at the American Legion right here in Beaver Dam, we're going to be doing the haircuts for vets. It's going to be the second year. The time frame in which we're going to do this is going to be from 10 to 2:30. I would highly encourage you. It's a first come, first serve, right? We're not doing reservations. We're going to have our stylists there. I'll be cooking up some brats, some burgers, some chips. And again, everything, there is absolutely no charge for our veterans to come on in, get a haircut. Plan on, maybe 15 to 20 minutes. But again, it's going to be a first come, first serve. However, come hungry because let's just say you come in and there's a couple other people that are in front of you. Sit down, have a burger, have a brat, have both. It's going to be a good time. Again, that's going to be at the American Legion. That's going to be August 20th from 10 to 2:30. So hopefully we can get a really good turnout, help our veterans out as much as we can, and offer a free haircut and get them a free lunch.
I like the fact that you say you're going to have a stylist there doing it. I imagine, for many of these guys, the last time they got a free haircut could have been when they joined the military and it just was gone and done. And they walked out looking like my hair is right now.
Sure.
Those of you watching on Daily Dodge Television, you'll understand just how high and tight I had to get mine cut recently. That mostly hides the balding, mostly.
Okay.
But yeah, it's a nice haircut you guys are providing.
Yeah.
It's a really nice haircut. You get to have a little bit of lunch. And if nothing else, it's a nice little bonding experience for everybody. Come together at the Legion building. Great location for it. Awesome that you guys do this. So we definitely wanted to take a moment to plug that again. And we'll bring it up again at the end of the show here real quick as well. Let's talk a little bit about something that I have always found kind of confusing. And I'm going to jump around from your list here a little bit, but Medicare supplement plans or premiums and the plans that go along with them. When I hear the words Medicaid, Medicare, Medicare supplement, Part A, Part B, Part D, Q, whatever. I don't know how many parts there are, but there seems to be a lot of them.
Too many.
One, how do you guys navigate all that?
Sure.
And give me a little more information.
Yeah. So just for the listeners out there, because that does get confusing, right? It's the government. So everything is confusing. Medicaid is a state-run benefit.
Like your Badger Care type thing.
Correct.
Right? Okay.
Basically, in order to qualify for that, you would have to be at or below poverty limit. You can be a little bit above it, but that is going to be based off of your income and whether or not you're even eligible for Medicaid. So again, Medicaid is state-run. Medicare is a federal program, okay? And then I would hope people know, but if not, right, in order to be eligible, you have to be 65 years of age and older, or the only other way to qualify for Medicare, being prior to turning age 65, you would have to be on full disability for 2 consecutive years. In the event that you're eligible for that, then you can apply for Medicare. So hopefully that
that clears that portion
helps.
up. Yeah.
Now going back to Medicare supplement, okay. Anybody that's on a Medicare supplement policy right now, you know your premiums go up every single year, right? It's not a matter of if, they will go up every single year. Why? Because in the state of Wisconsin, premiums are based off of attained age. What does that mean? Every year you go up, your premium's going to go up. They will also and can also go up with inflation, right? So where are we going with this? Typically, this is also the time of the year where you will get your rate increase, okay? Any time of the year, if for the individuals that are on a Medicare supplement policy, you can make a change from one Medicare supplement company to the next. And you can also, let's just say right now, for listeners out there, in a week, you get a letter from insurance company X, Y, and Z stating that your premium is going up 6.8%. You can call us immediately, and in the event, if we're able to find you a lower premium, you can switch to that company whenever you want. There is no annual election period or open enrollment period when it comes to Medicare supplement policies. If you're unhappy with your current premium that you have, you don't even have to wait for the premium increase. You can give our agency a call right away, schedule an appointment, or we can do it over the phone, or we can actually come to the home. It does not make a difference to us, whatever is easiest for the customer. And we can see if we can get that premium lowered. The only thing you have to do is be able to pass what's called medical underwriting. Now, medical underwriting does not consist of a nurse coming out to the home, you going in to get a physical, you having to do blood work. No. You have to be able to answer a series of questions that we ask, right? One of them is, have you been hospitalized in the past 90 days? Has a doctor told you to get back surgery done? You just are putting it off. Well, you're not going to be able to switch, right? More than likely, you're not going to be able to switch. However, if you're in relatively good health, you answered the medical questions pretty good or able to answer them, you can switch at any given time throughout the course of the year. Oh, wow. The only thing you have to wait for in order to make a change would be a standalone prescription drug plan that the majority of the people that are on a Medicare supplement policy, supplements do not cover drugs, therefore you have to get a standalone prescription drug plan. If that scenario is what any listeners out there are currently on, that to me, in my opinion, is where I think the biggest changes are going to be coming for next year. Those standalone Part D prescription drug plans. Again, I'm just speculating at this point.
Right.
But again, I would urge every single listener out there that's currently on a Medicare supplement policy that has a standalone drug plan, pay attention to those ANACs that are going to be coming. And as soon as you get them, give us a call.
Yeah. There's so much to navigate, and obviously you've got years of experience doing this. You've seen changes come down the pipe in multiple different forms, but it sounds like this is going to be one of the biggest, if not the biggest, changes we've seen in a very long time.
Yeah, and this is my opinion, in well over a decade, right? So it's going to be a busy year, but again, the responsibility is going to have to go onto the consumer, unfortunately, right? Because we can't reach out to every single Medicare recipient that's in Dodge County. I mean, number one, we just can't because it's illegal, and we just can't do that. But that's why we have these radio shows or different forms of advertising to try to reach every Medicare recipient that's out there that may not find this that important. Right. Well, for this year, in my opinion, it is going to be important.
Definitely better to be informed than not informed in this case.
Correct.
I see a note here that you guys had written down discussing 5-star plan. What's a 5-star plan?
Right. So the federal government, or the division of the federal government that has to rate every single Medicare Advantage insurance company that's in Dodge County, or for every county across the United States for that matter, the division of the government that has to rate these policies, and again, it's Medicare Advantage plans and prescription drug plans. They're called CMS, Centers for Medicare and Medicaid Services. Okay, so every year they will give a star rating to every policy that's out there, and we're just going to concentrate on Medicare Advantage plans right now. They will have to give the policy a rating. It's on a star rating scale of 1 stars all the way up to 5 stars. Okay, if an insurance carrier gets a 5-star rating from the federal government, any Medicare recipient that's currently on a Medicare Advantage plan, if they are unhappy with their current company and they would like to make a change over to an insurance carrier that got a 5-star rating, you can do so once, whenever you want, throughout the course of the year. Okay.
So you don't have to wait for that annual change enrollment period window.
Correct. So why I sort of wanted to bring that up is because there is an insurance carrier in Dodge County that has a 5-star rating. Oh. So for any of the listeners that are out there that, something happened or they didn't like the particular coverage that they had in 2024, and they're sitting there going, oh, I can't make a change, and that this change won't go into effect until January 1st. That's absolutely inaccurate. So for any listeners out there that are on a Medicare Advantage plan, they're completely dissatisfied with it, again, I would highly encourage you to call us, schedule an appointment. We can take a look at what the issues are with your current Medicare Advantage plan. And if that's going to be a better fit for you, right, enrolling into this 5-star plan, then do it. You don't have to wait. It can go into effect the first of the following month.
Is it common to get 5-star rated plans?
This particular insurance carrier got 5 stars the last 3 years running.
Oh, wow.
Yeah.
So that shows consistency, and
Correct.
Consistency is good.
Yeah.
Wonderful. I wanted to ask you about all the changes that are coming up. We talked about the annual enrollment thing that's going on. That's coming up soon.
Yep.
We all know about the American Care Act, the marketplace insurance. Does that affect that as well? Is that also only at a certain time?
So for the marketplace,
Right.
Correct. So the open enrollment period for that is coming up, but that's going to be a little bit further off. So that's always November 1st through December 15th.
Okay.
Right. We haven't really been notified much in terms of the subsidy levels that people that sign up for marketplace coverage are going to get, but let me backtrack on that. So if anybody that's listening that's currently thinking about retirement, who thinks that they're not going to be able to afford retirement because of their insurance costs, that's another reason where I would highly encourage you to just give us a call, even if you're thinking about it, right? Whether that's 1 year, 2 years, 3 years down the road. It doesn't hurt for you to let's just say, give us a call and have a quick conversation over the phone. We ask some general questions. At least we can paint the picture of what, your insurance coverage would look like and how much it's going to cost you.
Right.
Because I can't tell you how many times I will sit down and meet with individuals who do just that, right? Hey, I'm not thinking about retirement. It might be 1 year, 2 years down the road, but then we paint a picture for them of what it looks like. And then they actually are able to retire a little bit earlier because of these falsehoods that they were under the impression of what the insurance was going to cost. Right. It's major changes.
And I mean, again, that just proves that saying, if you don't know what you don't know.
Correct.
And much better to turn to the experts who know what's going on and can be able to map all that out for you. And that is part of the all-around stuff that you guys do there at Informed Choice.
Absolutely.
That is absolutely wonderful. Unfortunately, we are reaching the point in the show where we got to end. We got to end sometime. We can't talk all day. I do want to remind people again of the Haircuts for Veterans that's happening, and correct me if I'm wrong on any of this, August 20th, right here at the Beaver Dam Legion building, which is not too far from the radio station here.
Yep.
If you know where the big tank is, you can find it from 10 a.m. till 2:30.
Correct.
So free haircuts for veterans. Again, I'll repeat that again. Free haircuts for veterans. Stop on in. And then you said you're going to be there grilling up some brats and burgers for them as well.
Absolutely.
So it should be a great time. Highly recommend people make their way out there. I may just have to swing by to say hi when you're out there because I think that'd be great for us to, we'll throw that up on our Facebook and remind people to get out there and check it out. We also want to remind everybody of how they can get a hold of you. Again, we've mentioned the website, informedchoice.com.
Correct.
That's out there, and they can see your guys' information on there. There's a contact us on there, all the information there. The phone number, 877-4INFORM.
Correct. Otherwise, another easy way, 920-347-4700.
There you go. That works as well. And, of course, offices, again, in Horicon, Madison, Green Bay, and Fort Myers, Florida, because you guys have no problem taking it right to where the people are.
Absolutely.
That is awesome. Well, Troy, I want to thank you so much for coming on. It's always a pleasure talking with you, not just because I get to hear your amazing voice, but, even though a lot of this is maybe a long way off for me, it never hurts to be more and more informed every day.
Thank you.
Thank you for coming in.
All righty.
The the preceding has been a paid advertisement. The opinions expressed during it were that of Informed Choice, not necessarily WBEV or Good Karma Brands.